Well, in this video we want to consider the difference between droplet infection and aerosolized airborne infection. Now, when we breathe out, the air we breathe out has got a lot of moisture that we've picked up from our respiratory surfaces. And if there's any viruses or bacteria in our respiratory tract, we can breathe them out in these respiratory droplets of water. So here I am with my infection, and I'm going to breathe out these respiratory droplets. Now, most of them are fairly heavy and will fall to the ground or onto the surface I'm working with. That's important because if there's particles on a surface, like this, surface of a desk, shop counter, whatever it is, then I can pick those up with my hand as well and transmit them to my mucous membranes. So it can spread via surfaces, but very often in droplet infection, the infection goes right from the respiratory tract of the infected individual directly into the mucous membranes of the person that's going to get infected, notably the eyes, the nose and the mouth of the infected, of the person that's going to get infected. And the thing about this droplet infection is it's large droplets, they're quite heavy, most of them fall out of suspension quite quickly. If this person sneezes, if I sneeze over you, then it's going to blow it at you, that's going to help. If I cough at you, that's going to help. But the distances here are relatively short, so 1 metre to 2 metres is the sort of distance we're talking about for droplet infection transmission. So it's large particles, relatively short distances in our exhaled water. A lot of it falls onto the surface. That's why we have to be very careful with our hand hygiene in droplet infections. But aerosol transmission is different. Aerosol transmission is much smaller particles, and the particles can spread in the air in much smaller particles, and they can spread over time and distance. So here I am breathing things out, coughing, sneezing, even just breathing, and we get infected particles, bacteria or viruses in the air. Now, if there's a wind, that will blow them in this direction and infect another person over here. So it's different from droplet. Droplet is this close range. Aerosol is longer range. Heck, they could even be in a different room. So these people could be in a different room. And it could just go through a ventilation spout or something like that. So that's an aerosolized infection. Much more transmissible over much longer distances. Very important difference between droplet infection and aerosolized airborne infection. But let's look at this in a little more detail now. So when we're thinking about aerosol transmission, aerosols are particles, they're tiny particles or very small droplets in the air. So whereas a droplet infection are quite large particles, the aerosol infection spread in the air are absolutely tiny particles of moisture in the air. So person-to-person transmission of pathogens, viruses or bacteria through the air. This is what we mean. This is what we mean by aerosolized infection as opposed to droplet infection. Inhalation of infectious particles. So they can go from one person, they can go from me, and then they can infect you in these tiny particles. Now, this is interesting because if we think about the respiratory tract, so here we have the respiratory tract. Starts off quite large with the mouth. We have the mouth and we have the nose up here. So that's air getting in through the nose, through the mouth, down through the pharynx into the trachea. That's going to divide into the main bronchial passages. And these go into the lungs, of course. Now, these are going into the lungs. But as we go into the lungs, the airways get smaller and smaller until eventually we're dealing with absolutely microscopic terminal bronchioles and respiratory bronchioles, leading to the alveolar air sacs, because this is an absolutely microscopic size now. Now, the smaller the particle, the deeper they can go in. So large particles will be inhaled, filtered out in your nose. Larger particles still filtered out here, but the very small particles will go straight down to the bottom. And they'll infect us right down at the bottom here, or cause pathology right down at the bottom. This is the problem with small particles. They go straight into the lungs. They're not filtered out by the cilia and the mucus in the upper parts of the airway. So inhalation of infectious particles Now, up to 100 micrometers are inhalable. Now, microparticulates, PM10s, are less than 10 micrometers and can be inhaled down into the lung tissue, as we saw, right down into the alveoli or the bronchioles. Now, viral particles, if that's 10 micrometers, then a tenth of that will be 1 micrometer, and viruses can be 100 nanometers, which is a tenth of a micrometer. So they're 100 times smaller than that. So viral particles can go into the lungs, no problem at all. So anything smaller than 5 micrometers, smaller particles allow an airborne transmission. So bacteria are about 1 micrometer. Viruses are about a tenth that size, so they can go into the deeper parts of the lungs. So aerosol transmission can be transmitted via coughs and sneezes, or talking, or just exhaling. This is the difference. So talking and exhaling can spread it. And they can travel over distances. Airborne spread is over distance. And that depends upon the initial velocity. So if you cough or sneeze, that'll put it out quickly. It'll depend on the airflow going through air systems or fans. And it will also depend on the humidity. But this is the difference. It goes in the airflow. It flows in the air and it remains active over time and over distance. Droplet infection does not remain active over time and distance in the air. So you don't even need to be in the same room as the person that infects you with aerosolized airborne transmission. So just to clarify a little further, droplet versus airborne transmission. Respiratory droplets transmit infection directly from a respiratory tract, from my infected respiratory tract, onto your mucosal surfaces, your eyes, your nose, your mouth, generally over short distance. That's why facial protection is good for droplet infections. Now, having said that, there's no clear line, there's no absolute scientific definition of what is a droplet infection, what is an aerosolized infection, but it's clear bacteria and viral particles are much smaller than the minimum sizes that we're talking about. They're way smaller than 5 micrometers. A bacteria is 5 times smaller, a virus is 50 times smaller than these particles that can still go right down into the bronchioles and the alveolar of the lungs, alveolar air spaces, infecting the lung tissue directly. Now, by way of interest, N95 masks, which people talk about a lot, or high, these block at least 95%, that's why they're called N95s, down to 0.3 microns. So that's not going to filter out viral particles. And if someone's in close contact, they can be both a respiratory infection can be transmitted both via droplets and via aerosolization. So it can be droplets or in the air, whereas the longer distances can only be airborne, aerosolized. It can't be droplet infection. So this is a critical difference. Aerosolized airborne infection can spread over time and distance, therefore making any aerosol-borne infection much more transmissible.